Hello, welcome to the Auditory Learner. This is going to be the very first auditory study guide for histology embryology. And we will be doing today, the goal would be for chapter 1, 2, 3, and chapters 4, 5, 6 at the very least. And that's going to be review of the head and neck regions, oral cavity, pharynx, overview of the prenatal development, development of the face and neck, and development of oral facial features, as well as tooth development and eruption. It's kind of a lot, but I think the beginning is going to be quick because it's kind of a review. So let's talk about chapter 1, which is the face and neck regions. Here we're going to be talking about certain conditions of the skin as well. Also, we might need to know the difference between carcinoma and sarcomas. We know that carcinomas are more lymph and epithelial related, while carcinomas are blood related type of cancers. All right. And so, when Professor Ogami went into her case study, which is why we might see older patients who have their vermilion border or their lips are sort of disappearing. Also, if we check to see that there might be some burns of the skin or something, that might be an indication of a carcinoma. But regions of the face, we know this: frontal, orbital, infraorbital, zygomatic, buccal, oromental. The ones I'm going to need to know just to make sure is infraorbital is below the eye, mental is right in the front of your chin. Everything else should be pretty much self-explanatory. We need to know what to do if we encounter an enlarged lymph node, because that might be a sign of some sort of infection or fighting that's going on by the white blood cells immune system in our bodies. On the front infraorbital part of our face, we have the facial lymph nodes, and we got the superficial parotid lymph nodes, which are on the outside of the parotid gland. We need to understand where these lymph nodes are located. So there's also deep parotid lymph nodes. Those are going to be when the parotid gland is not visible, so that's inside. So that'll be good to know in case we need to understand that or label that. Okay. Lymph drainage patterns, lymph nodes of the head, we need to know that. Again, frontal regions of the face, we know that. We talked about that. Also, if we're looking at the facial nasal region, the root of the nose is located between the eyes, and the tip is the apex of the nose. Okay. The nares are also bounded laterally by wing-like cartilaginous structures called ala or alae. All right, those are basically the outer edges of their nostril, and the thing that separates our nose down the middle is the nasal septum. Then we have the nares, which is the opening of our nostrils, and the apex of the nose is the tip, and the ala, again, is the outer lateral edges of the nostrils. That's the ala, okay? Again, the root of the nose is located between the eyes. The apex is the tip, okay? Ala is the outside, and the nares, nares, or plural nares, is the nostril opening, okay? The opening of that. So in case we need to visualize and be able to label this, just again, between the eyes is the root of the nose, the front tip of it is the apex, the side of the outer nostril is the ala, the going down, right down the middle is the nasal septum, okay, and the nares, there we go, good. We need to understand where the parotid glands are, the submandibular glands, and the sublingual glands, including their ducts, and what kind of saliva these glands secrete. such as serous versus mucin. We need to understand um, also like Stenson's duct versus Wharton's duct. If I'm correct, Stenson's duct is the parotid duct, and Wharton's duct is the submandibular duct. Yes. Yes, 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 that should be correct. We'll talk about that more later. As well as on the vermilion borders of the lip, that's where we find herpetic lesions. Mostly we should reschedule the patients. Also, if we want to label the lip visually, we need to see a pair of lips. You have the upper lip, the lower lip, correct? The tubercle is basically the very front tip of your upper lip. The vermilion zone is the border of your lip. The philtrum is that dip that goes right under your upper lip and your apex of the nose. That's the philtrum. Then we have the corners, which are the labial commissures, and the vermilion zones are like the front parts of our lip, basically upper and lower. So again, tubercle, the front tip of the upper middle lip, and then the vermilion zone we know, and the philtrum is just that depression that's right above the vermilion border of the upper lip and under the apex of the nose. Cool. So we might need to label that. We need to understand that. Angular cheilitis could be a B12 iron deficiency or zinc deficiency. That would be requiring nutritional counseling. We would see that on the commissures. Also, if we see loss of vermilion border, it's important to know it's harder to determine the border, then we might recommend them to see a dermatologist or use chapstick or sunscreen. We need to know how to label the mandible as well. We'll go into that more. But one of the main things we need to understand is make sure you know where the body of the mandible is and the ramus of the mandible, right? Which is like that outer portion, the long left or right section of the posterior mandible. That's the ramus. The body is mostly the outside body there. We know where the coronoid notch is. The coronoid process is just right above that. That is sort of parallel to the articulating surface of the condyle. Okay. One thing we need to understand is, when we're labeling regions of the face as well, we need to know where the temporomandibular joint is, which is that little ball and articulating place right in front of the ear. The condyle is what goes in there. The mandibular notch is the bottom of the U between the coronoid process and the neck of the mandible, which is the temporomandibular joint. So that little bottom part, that's the mandibular notch. The angle of the mandible is the outermost corner of the lower left and right part of the outer mandible. We need to understand the coronoid notch, which we know already. So in case we need to label that, we know that 1 is the temporomandibular joint, 2 is the mandibular condyle, 3 is probably the masseter muscle, angle of the ramus, or that could be the ramus. I'm looking at the regions of the face review, and then the mental region, the buccal region. It's a little bit different than what I just described earlier, but make sure we understand the regions like zygomatic, the infraorbitals, and the buccals. Okay. Understand facial dimension. Facial dimension gets smaller with edentulous patients and older patients as well. Okay. So we know all this stuff here. Make sure we understand where the mylohyoid muscles are, which is right below or above these submandibular glands. All right. Make sure we know that stuff. Even though she said there's only going to be 15 labeling, you never know. Okay. Stenson's duct. Make sure you understand where that is, which is basically the parotid duct. Cool. And before we continue, which I should have done also in the beginning of this recording, would be to just take a look at the study guide for the final exam. So the study guide for the final exam is telling us here that we should review the basic head and neck anatomy, which we just went over. There's going to be 65 multiple choice questions, 10 true or false questions, and 15 points of labeling, 10 points of matching. So 15 points of labeling are could be just 15 matching labeling locations. We just went over a lot of it, and it could expand across the whole embryology class. So I think there's going to be very minimal basic head and neck anatomy labeling, just because we've reviewed that since we started the program, and this class is particularly important with embryology. So I'm going to roll the dice on that. The histology of embryology. And then, so the next thing we need to make sure we review what is developing at each week of prenatal development. Make sure we know which structures start to develop in each week and when the processes end. We will get into that very, very shortly. We need to understand the cell development with just two cells, the prenatal and pre-implantation embryonic fetal periods, cell development with just two cells, sperm and egg, and then how they move on to a ball of what, which is a morula, then it turns into a blastocyst, blastula, then a bilaminar, then the yolk sac, and then the trilaminar. So we're going to talk about all that process of the blastula. How does this disc fold and develop a head tail? Then we talk about facial development. Focus in on just the facial development, review the process of the brachial arches. We will do that. How does the lip and the palate form? Perfect. We need to review the primary and secondary palate of which week. Sounds like week 4 to me, but could be also 5 or 6, but let's move on. We're going to review the tongue development, review the different types of taste buds and lingual papilla. We're going to talk about tooth development. When we focus further on tooth development, when does tooth development start and end? We need to understand the initiation, bud cap, and bell stage. 1, 2, 3, 4 bud cap, bell stage. Understand the functions of dental lamina and dental papilla. Make sure you know all the different types of tissue layers involved with tooth development. Root formation, and what's the eruption process? Oral tissues development, the types of mucosa, masticatory lining, lamina propria, what are those things? We just went over this stuff, but she's gonna test us on salivary and thyroid and lymph glands, nasal and sinuses tissues. Which part of the salivary glands contain secretory cells? Which characteristics of each type of major salivary gland? Which type of saliva? Know the locations of different tonsils. Perfect. So that's kind of a review of everything. Look, she didn't put that much, so we might as well just do the whole thing, which is not that much left. She also wants us to understand enamel, dentum, and cementum of the periodontium and PDL. This is mostly chapter 14, now that I think about this. So again, back to the tissue development, different structures of the mouth, see where you can identify it. Many of you did a wonderful job describing the basement membrane. Please review those posts. All right. Be able to identify the different types of oral tissues and the junctions of these tissues. Okay. So we just did prenatal development. Okay. No, we just did basic head and neck anatomy. I feel like for this video, we're going to split it all into 2 parts. I'm going to talk about the oral cavity and the pharynx very little, because she doesn't really talk about that much in her study guide. Just went over the head and neck anatomy and facial anatomy. So let's move on with more of the oral cavity and the pharynx. Okay. There might be an irritation of tissue, which is called a fibroma. And then a Fortis granule is a fatty deposit in the tissue. All right. We don't diagnose, we just say appears as. We know the anatomy of a tooth. Okay. The root portion has no enamel. Okay, the root portion has cementum, dentin, and the root and the pulp. So if that question comes on, make sure you know that. Um, we're gonna also move on forward, knowing the a little bit of the anatomy of the dental arches inside a mouth. Right next to the tonsils or the opening is going to be the fauces. Make sure you can understand the difference between maxillary tuberosity and the retromandibular retromolar pad for the mandible. They're kind of the same, just like opposite different names. Tuberosity and retromolar pad, tuberosity upper, retromolar pad lower. Um, we already know about the pterygomandibular fold, um, and the uvula, which is the punching bag, the soft palate, and all that stuff. Okay, teeth, make sure we know exostoses, which is basically like tori on the buccal, caused also by clenching, mandibular tori. If people have that, we're going to do toothbrushing modification, x-ray modifications. Um, moving on forward, we're going to get into the difference between alveolar mucosa, mucogingival junction. We know all that. The attached gingiva has pigment, melanin. Um, So we do know all this stuff already. Palatal torus versus mandibular torus, the palatal rugae, the incisive papilla. All right, we know where that is. Palatine rugae and the medium palatine raphe. We know that the rugae is used for speech. Okay. Um, we're also going to move on forward and um, the palatal torus. There's lobulated, which is like the biggest version of it. We need to understand where the fungiform and filiform papillae is. Um, the fungiform is going to be on the outer surface, filiform side surface. Okay, but they kind of are in the same place, to be honest. But we'll review that better. Remember, dorsal is top, ventral is bottom. Apex of the tongue is the tip of the tongue. All right. Okay, so here the foliate papilla is on the sides of the tongue. All right. So that's why we didn't talk about when I mentioned the fungiform and the filiform are like on the front. Fungiform would be mostly on the front, I believe. Filiform is on the front, but on the side, and then the very side is going to be the foliate. Okay. Um, so make sure we understand that the ventral, you know, dorsal, and the lateral sides of the tongue. Okay. Make sure we know to use those words when we're labeling. All right. Um, also the pharynx. I don't think she's going to talk about that much, but okay, we're going to go now into prenatal development. All right. So here's like the juiciness. What is happening at each week? All right. What structures start developing in each week and when the process ends? All right. Prenatal, pre-implantation, embryonic, fetal periods. And we just kind of went over that again. So here we go. There's the prenatal development, there's the pre-implantation period, there's the embryonic week period, which is the second, third, and fourth week. And then after the embryonic period is the fetal period. Okay. So after the fourth week, it is now a fetus, which is a month. All right. So in prenatal means before birth. Primordium is the earliest indication of a tissue or an organ during prenatal development. Gestation is just another word for the amount of time spent in the womb. So prenatal development begins at the start of pregnancy and continues of the birth of the child. There's a debate between when pregnancy starts. Usually it's 9 months of gestation. It's usually divided into trimesters, all right, every 3 months. So, periods of prenatal development, we know that we start as a zygote, then a blastocyst. Blastocyst turns into the discs, then where discs turns into the embryo, and then the embryo turns into the fetus. Cool. So those are basically the trimesters right there. So the first trimester, it's like zygote, blastocyst, disc, embryo, then goes from embryo to fetus, and then the fetus develops even further until it turns into a full-blown baby. So the pre-implantation period is when there's fertilization or conception of when an ovum and a sperm unite. Okay, the zygote is a fertilized egg. So a zygote is when the ovum and the sperm come together. All right, then we have the egg. During fertilization, the final stages of meiosis occur. Again, meiosis is splitting, replicating DNA, and mitosis is just replicating. Okay, meiosis splitting. So meiosis is 4 daughter cells. Mitosis is 2 daughter cells. Okay. There's a longer process for meiosis than there is for mitosis because there's more at the end. Okay. Um, meiosis only occurs in reproductive chromosomes. So a diploid has 46, a haploid has 23. Karyotype means X and Y chromosomes. XX is female, XY is males. All right. So the pre-implantation period is when mitosis or cleavage happens. Then there's a solid ball of more cells, and that turns into the morula. Once the cells start to migrate within the cell, that's a blastocyst. Okay. But at the end of the first week, the blastocyst then undergoes implantation. And then it starts preparing the endometrium. All right. So blastocyst approaches the endometrium. The trophoblast are the outer cells, and the endometrial tissue grows on the blastocyst to cover the implantation. After a week, the blastocyst consists of the trophoblast layer and the peripheral cells. The embryoblast layer is the inner part. So again, after 7 days, um, that is implantation right there, basically. All right. So you got ovulation, you have ovum, sperm creating a morula. The morula goes into a blastocyst, and then the blastocyst begins implantation at 7 days. All right. Um, Also know that Down syndrome is a disturbance of meiosis, which is trisomy 21. There's extra number of the number 21 chromosome. All right. Um, they have a higher risk for problems such as GERD, periodontal disease, microdontia, and an enlarged tongue. We go into the embryonic period, which is the second period of prenatal development. All right. It's the beginning of the second week of development to the end of the 8th week. Kind of confusing the way this is placed here. So, but the embryonic period, beginning of the second week, yeah, well, because I think after this is the first week, it's already implanted, and then that's when we begin. Okay. All right. So, embryonic period, there goes a lot of things that happen. Um, we have induction, proliferation, differentiation, morphogenesis, and maturation. Induction is the physiological process. Induction is when we start developing what's called a mesoderm, ectoderm, endoderm. Okay. And it's happening through, after induction, it's proliferation, which causes appositional growth. Um, when you think of appositional growth, you want to think of bone, like the rings of a tree. Tissues enlarge by size, by the addition of layers on the outside. Then there's interstitial growth, which is inside. Tissues enlarge. All right. During the embryonic period, there's also differentiation. Different tissues specialize to create different systems. All right. And we just kind of talked about that. and then things begin to mature, all right? And then that's when we start seeing the formation of certain organs at this point. So just to review that, there's induction, proliferation, differentiation, morphogenesis, and maturation. Um, so the second week is the embryonic period. We have the bilaminar disc. Okay. In the bilaminar disc, there is an embryonic disc. We have the amniotic cavity. Okay. We have the yolk sac. We have the endometrium of the uterus, the epiblast, and the hypoblast. So the bilaminar disc is made up of epiblast and hypoblast. Okay. And the bilaminar disc has a superior and inferior layer. That's epiblast and hypoblast. Epiblast is high columnar cells. Hypoblast are small cuboidal cells. All right. So make sure we understand that in the bilaminar disc during the second week, the epiblast is high columnar, the hypoblast is cuboidal. During the third week, we have what's called a primitive streak that forms within the bilaminar embryonic disc. This marks the start of what's called gastrulation, which is the formation of the three layers, which begins the trilaminar disc. All right. So gastrulation is the beginning of the trilaminar disc formation. Okay, we might need to be labeling this as well. So there's this weird image. Just know that the right upper front portion, there's a primitive streak. Then there's the amniotic cavity and the yolk sac at the bottom. So yolk sac is the most bottom. The primitive streak is right in the middle when we're looking at a cross section of it. There's this weird looking image that I'm staring at here that we might need to label. So epiblast, hypoblast. All right, we're not talking about mesoderm and ectoderm stuff yet. This is still the third week. Um, Here, though, now the bilaminar disc turns into a trilaminar disc. All right, and then here we're going to start talking about what's called a mesoderm. All right, embryonic bilaminar disc includes the epiblast, migratory cells, and hypoblast. So bilaminar is that. Okay. Again, for trilaminar gastrulation is the formation of the trilaminar from bilaminar. Okay. So then and that also creates the endoderm, the mesoderm, and ectoderm. Okay. So ectoderm is the top, the mesoderm is the middle, and the endoderm is the bottom. Okay, that's like the closest to the yolk. All right. We have the cephalic end, which is all the way to the left. And we're looking at the plane. Um, Again, if we're looking at a cross section, the ectoderm is the top mustache looking yellow thing, the bottom. The middle is the mesoderm, endoderm is the smile. We're going to just say. Ectoderm comes from, gives rise to the nervous system, which begins at the neuroplate. So there's ectoderm is now does neuroectoderm, and that is where we have the neuroplate and the neural tube, and then there's folding of the neuroectoderm to create the central nervous system. Okay, on the third week, we see neurocrest cells, which is the fourth embryonic layer. She said this is going to be on the test. So neurocrest cells are the fourth embryonic layer, which are developed from neuroectoderm. Okay, the neurocrest cells come from neuroectoderm, and the neuroectoderm comes from the ectoderm. Okay, ectoderm is top. So neurocrest cells is when we see that folding, and that migrates from the crest of the neural folds and disperse within what's called the mesenchyme. And this will also develop into certain oral structures. All right. So by the end of the third week, the mesoderm differentiates. Then we have somites, which become the vertebral part. Um, so somites that are located on the side developing nervous system. Embryonic folding. This disc undergoes after the prenatal development with embryonic period. The disc goes embryonic folding. Um, developing heart, that bump in the middle, developing brain. The foregut gives rise to the primitive pharynx. All right, so there's all this stuff here. Treacher Collins is a disturbance during the embryonic period. That's a horrible thing. Um, some things we want to just make sure we understand here. Okay, tetracycline stains also happen during development. Is what is it that we need to understand here? Is the fetal period is involving the zygote, the embryonic, and the fetus. It starts at the fetal period, it starts at the ninth week of development, or the 11th week of pregnancy. Okay. So amniocentesis is amniotic fluid that's sampled during the week. Most common invasive test may detect some malformations. Um, we're gonna end it here for this, just because it's been a little bit already. And what I'm gonna do as well is I'm going to go into some of the assignments that we've made. And just to confirm what it is that we know now. All right. So something that we want to talk about here, what's occurring at each step, right? So we have this whole list, not a list, but a drawing of a sperm, a zygote, an ovum turning into a zygote, zygote turning into a morula, morula turning into a blastocyst, blastocyst going into blastula, blastula going to implantation, implantation going to bilaminar disc, bilaminar disc going to trilaminar disc, which is through gastrulation. And then this is still the fetal embryonic period goes into the fetal period. Okay, so we need to just kind of make sure we know how to describe this. All right. So here's one thing that someone said. Um, week 3 is pre-implantation period. I don't think so. No. We're not gonna talk about the weeks right now, okay? Blastocyst, blastocyst zona pellicuda, bilaminar, primitive streak creates a trilaminar. So not sure what Tuesday was putting on here. I don't think so. However, you focus on key concepts of developmental stages, which is the objective. Great job. One improvement that can be made is to provide information, differentiation, and maturation. Okay. Um, so I like what Michelle is doing here. The first step of pre-implantation period is the union of sperm and cell and ovum, which is fertilization. Once the sperm and ovum have united, they produce an egg called a zygote. Okay. During the fertilization, the final stages of meiosis occurs to form small daughter cells and become blastomeres. So meiosis is the, the daughter cells. I'm thinking that it's the 4 of them because it's, and then my2's, yeah, mitosis is my2, yeah. Okay, but at fertilization, meiosis, 4. Okay, that then turns into, after fertilization and the zygote undergoes cleavage, that turns into the morula. And the cleavage, individual cell division is mitosis. rapidly occurs. Blastomeres keep replicating themselves and arrange to form a ball called the morula. So mitosis is two, so that's occurring inside the fertilized zygote. Okay. Um, two, mitosis inside the fertilized zygote. Blastocyst attaches to the endometrium of the uterine wall. Tissue grows perfect. Second week, prenatal development, part of embryonic period, bilaminar disc. Da, 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 da. Again, haploid is 23, diploid is 46. All right. So looks like we know what's happening here. Okay. Um, any other review that needs to be done? Just kind of check in. I think we're straight on this. But yes. Gastrulation, remember trilaminar. So there's a lot of things we can say about what's happening during this period, but what we would just want to make sure the prenatal period, pre-implantation period, embryonic and fetal periods. All right. Sperm and egg ball, what is this? Then to a bilaminar, okay. Process of bastula, distal tail end. Okay. So there's so much. It's like, okay, embryonic development is from week 4 to week 8. All right. This is the source from Lisa. So at week 4, we can begin to hear the heartbeat. Arms appear, eyes appear, the somites, all that's starting to look already. Then the 5th week, eyes start to form, legs build. 7th week, hair follicles. 8th week, face begins to look like a human. All right. Um, and that's how it is, man. We're gonna end it right here for now. All right. So that's gonna be the end of this. On to the next one. The next one is going to be about facial development, tooth development, oral tissues, more salivary gland, and chapter 14, enamel dentin cementum, and the tissues there. Okay. All right. Cool.